Hello and welcome back to the Medicare Team podcast. My name is Sean Heffron, licensed agent, and I am joined here today by.
My name's Thomas Fulmer. I'm also a licensed insurance agent here at the Medicare Team.
And for today's episode, we kind of just want to talk some things about how to choose the right Medicare plan this year. So I think the first thing I'd like to touch on, TJ, is kind of just the enrollment basics, just kind of the basics of, enrolling in Part A and Part B. When does that happen automatically versus when does that happen manually?
Yeah. So the biggest thing there with the automatic enrollment would be if you are already drawing your Social Security benefits or the Railroad Retirement Board benefits, you are going to be enrolled already automatically when you turn 65. It'll be the first day of your birth month. So if you're born on October 15th, it'll start October 1st. If you're not drawing any of those benefits, you are going to have to go to the Social Security website yourself or give them a call and sign up for Part A and B manually. And we can actually, here at the Medicare Team, we'll help you take care of all of that when you give us a call. So.
And to touch a little more on that, when you are saying that if you're already collecting Social Security, you'll automatically be enrolled, is that for Part A, Part B, or both?
It's going to be both. If you're drawing the Social Security benefits, your Part A and B will both automatically start the first day of your birth month.
Okay.
Yeah.
Okay. And then with that, I also want to talk about, the coverage pathways, comparing the Medicare supplement, or also known as the Medigap, versus a Medicare Advantage. I want to kind of talk on the networks of both of those and kind of what they look like.
Yeah, for sure. So that is a main difference, actually, in Medicare Advantage versus Medicare supplement plans. So for Medicare Advantage plans, and we've talked about this actually a lot on our previous podcasts, but just to recap, Advantage plans, your doctors have to all be in network, depending on which Advantage plan you have. So if you have a Humana plan, it's an HMO, and you have 3 doctors, you're only going to be able to see the doctors that are in network with that plan. And not every doctor is in network with every plan. So if you have like I said, a Humana plan, not every doctor that you have, even if it's in network with that one, does not mean it will be in network with the other one. So that's a big thing to consider there. Versus Medicare supplement plans, you are free to see any doctor in the United States that accepts Medicare Parts A and B. So that is a major benefit of having a supplement plan rather than Advantage plans.
Mm-hmm. And when you're kind of approaching the Medicare side of things, like you said, I know if you're considering Medicare Advantage, it can be confusing because you could have 2 or 3 different plans that are all offered by Humana, but that doesn't mean that, the same doctors are in network with all those plans. Even though it's the same company, the same carrier, you do have to make sure that your doctors are in network with your specific plan. So it's, just another reason that talking to an agent is very important. We can see who's in network. We can let you know. We can help you, if there's not doctors available in that network, we can help you find doctors that are. So it's very important, like I said, to talk to an agent about some of those things.
Yeah. So, and another thing with that is, since with Medicare Advantage plans, you have to stay in that network, people that travel often, that have family on, different parts of the country, you're not going to be able to have coverage or see doctors that are covered if you're in a different state or a different, coverage area.
And that's because certain plans are only available in certain areas, correct?
Correct. Yeah, exactly right. So, if you have a family member that's on Medicare, a brother or a sister that is getting benefits that you're not getting, and you're wondering why you can't receive the same ones, that's because it does differ by area, zip code. So that might be why that is. But yeah, for people that travel a lot, supplement plans will benefit you much, much more. Because like I said, you can see any doctor in the country that accepts original Medicare, which is Part A and Part B. So you'll be good there.
Mm-hmm. And even with the Medicare supplement or the Medigap policies, despite them having a higher monthly premium, like you said, it does come with that flexibility of not having to worry about that network of doctors. Or if you are someone that travels heavily, you don't have to be concerned about, can now that I've traveled to this state, am I going to be able to see these doctors
Right.
here? That's the really nice flexibility that you do get with a Medicare supplement compared to the Advantage side of things.
Yeah, and that's, a lot of people, like you said, they are paying a higher monthly premium, and that's because people want peace of mind. They want flexibility to see whatever doctor they want to see without referrals.
Hmm.
And there are Advantage plans that do offer some flexibility as well, called PPOs. They're a little bit different than the HMOs that you see. Just to touch on that real quick, PPOs, Advantage plans at least, allow you to see doctors that are out of network, but you will have to pay the out of network rate, which is almost all the time more expensive than the in network rate. So just be wary of that if you are on a PPO Advantage plan. So, yeah.
So maybe another reason that people could, call an agent and just see whether, the Medicare supplement side or the Medicare Advantage side is more suited for them. I
Yeah,
think that's really important.
it is.
And then, so to touch back on, the premiums and what you pay each month, how often do you see people make a decision based solely on that, the lowest premiums?
Yeah, a lot of the time. And that is because they are not educated enough about what is covered under each plan. So a lot of people choose Medicare Advantage when they turn 65 just because they do see that $0 price tag a month and they think, hey, I'm getting a good deal here. And a lot of the times for a lot of people, it is a good deal and it is, a good plan to go on. But if you're not aware of what it covers and the out of pocket costs that it does not cover, that could come back to bite you later on. So, I mean, just for example, Medicare Advantage plans differ. The big difference between Advantage plans and supplement plans is Advantage plans, as you know, have different copay structures,
Mhm.
right? To where supplement plans, you don't have copays to pay. You pay that high monthly premium and then you are covered. It gives you peace of mind. So that's pretty much the big difference there. And people on Advantage plans that are picking it solely based on the $0 price tag are oftentimes not aware of the copays that
The
come with it.
costs that come
Right.
with that, yeah. And even to touch more on that, like you said, I see it all the time. We talk to people about both the options. As soon as you see a $0 monthly price tag, like you said, of course, that's enticing. But, if people don't talk to an agent and they're not well informed, they don't understand that the costs that come down the road. You know what I mean?
Exactly.
You
Yeah.
may have a $0 monthly premium today, but, God forbid, if you're hospitalized, you may have to pay. I've seen anywhere from five, six, even $700 per day for a
Yeah.
hospital. And so it's nice to not have that payment today or each month, but as time goes on and your health changes, you could incur a lot of costs.
Yeah.
So that is, another reason that you want to talk to an agent and just kind of see, where you fit better, the supplement side or the Advantage side. And with all the things that we've talked about, the network of doctors, how much you travel, how healthy you are, your finances, all of these things go into it. And so again, it is just very important to talk to an agent and we can kind of help guide you to one of those options.
Yeah. For sure. For sure. Another thing we wanted to get into today was drug costs, and we'll kind of touch briefly on that. So, a lot of you, as you may know, there is a penalty for people that are just turning 65 if they do not elect to have credible drug coverage or Part D included with their Medicare when they turn 65. That is, correct me if I'm wrong, but that is 1% every month that you
Yes.
do not have Part D active since
Yep.
you turn eligible. Okay, gotcha. So, as you can imagine, 1% every month, I mean, that after 10, 15 years, that stacks up. And then, you may be healthy for those 10 to 15 years. You get prescribed drugs, and now you have to have Part D drug coverage, and you're paying $70 a month for
Just for a
something
penalty.
just for a penalty.
Yeah.
So that is one thing that people, really, really need to pay attention to.
And it's so funny because I just spoke to an individual last week that was transitioning from work insurance to Medicare, and that was a question she had. She said, "Listen, I'm relatively healthy. I don't really take any medications. Do I should I elect Part D coverage? What do I do? And I told her basically what you said. Listen, I understand that you're healthy now and it just may seem redundant to have that coverage, but at least if you do have that coverage, you won't have the penalty. Then down the line, if you do have medications, you won't have that penalty.
Right.
And to just, give a little story, we talked to someone that I believe they went 12 years without having Part D coverage.
Wow.
And so you can imagine quite a hefty penalty was placed upon them. I
Yeah.
believe it was about $78 a
Wow.
month, which, there are other coverages that are less than that you could have in place that now you're just paying $78 for basically nothing just because you chose not to have that coverage when you needed it. And so it is really important to not only talk to an agent, but, despite even if you are healthy and not taking medications, it is still very important to have that coverage when you become eligible.
Yeah. Exactly. Exactly. And one other thing that I wanted to talk about today was, going back to the enrollment basics, is if you're still working, you can elect to delay your Part B to start if you're going to continue to stay on your work insurance before you have Medicare or before you sign up for Medicare. That way, you don't incur a Part B penalty because there's a Part D penalty, which is your drug penalty, and also a Part B penalty if you don't sign up for Medicare once you become eligible. And you can go through the Social Security website as well, get that information. Even if you call us here at the Medicare team, we'll help you, go through all of that as well. But I did just want to say that there was a Part B penalty as well that you got to be careful of.
Yeah, and that's slightly different than the Part D penalty. I know the Part D penalty is 1% for every missed month. The Part B penalty is, like I said, slightly different. It's 10% for every 12 months missed.
Yep.
So for every year that you miss not having your Part B, you'll incur 10% added on each year.
Correct.
And then to just give it a little example of the enrollment basics, I talked to an individual 2 weeks ago. They were 65. They are still currently working and they're going to work until they are 67. So she chose to, her Part A was automatically instated for her. So she had her Part A. And then her question to me was, should she sign up for Part B? Her current work insurance already covered everything that Part B would have covered. And so we let her know it is, more advised to delay that Part B until you retire at 67.
Right.
That way you're not paying for Part B, which your work insurance already covers.
Yeah.
So there's an example where you would delay that Part B until you retire. She wouldn't then have a penalty, and that's best case scenario for her.
Yeah, exactly. You're exactly right there. And that is why it is super important to talk to one of us here, so you can avoid that penalty. Whatever penalty that is, Part D, Part B, we don't want you to have anything. So please call us here at the Medicare team to get that figured out. Another thing that I wanted to talk about today was it kind of, goes in line with the enrollment anyway. It's when you can enroll. So for med sub plans, that is 6 months before you turn 65. And you do not have to have Part A or Part B to lock in your med sup rate. So that is a big benefit there. If you want to just, for peace of mind, have everything taken care of before you turn 65, we can actually set that up for you, have it all ready to go on the first day of your birth month. And just have everything pretty much set up for you, whenever you're ready to go. It's a little bit different with Medicare Advantage. Do you want to touch on that a little bit?
Yeah, with Medicare Advantage, like you were saying, it is a little different. You don't have quite the extended period that you do with Medicare Supplement. And for Medicare Advantage, you can enroll in an Advantage plan 3 months before or after your Part A and Part B effective date.
Yeah.
So, for example, if we were talking to you and you turned 65 October 15th, your Part A and Part B would start October 1st. And 3 months before that date, then we would actually be able to help you get enrolled in an Advantage.
Right.
So it is very important. There's different timelines with all of these things. It's, it can be confusing for somebody on the outside that isn't dealing with it every day. So again, just very important to talk to an agent and, have them help you set that up at the correct time. Again, that way you don't have any penalties or don't miss anything that you may need.
Yeah. One more thing that I wanted to touch on too, with the Medicare supplement plans is what is the, I guess, hidden trap of enrolling in a supplement plan after being on an Advantage plan, since you've started Medicare?
Mm-hmm. So, with Medicare Supplement, there are basically two ways in which you are enrolled. So, when you are initially coming into that age of 65, and what you talked about these 6 months before, if you enroll in that time, it's known as a guaranteed issue, which means they are not going to do any medical history checks or any medical checking at all. You will just be able to be enrolled in that plan. And that is best case scenario. You can have a condition where maybe, down the line it would disqualify you, but because you're just turning 65, you can still enroll. So it's really, really good there. The hidden trap, or, I guess the hiccup kind of with it is if you wait and you pick an advantage first and then you would like to switch to a supplement later, and say you're 67 now and want to switch to a supplement, you may no longer have that guaranteed issue right. And it may be what's known as underwriting, which means they will do a medical history check or they may ask you some qualifying clinical questions. And there's a chance that you may have a condition or an illness that actually disqualifies you from a Medicare
Yeah.
supplement.
Mhm.
So it is really important, to again talk to an agent. And when you are approaching that age, kind of just talking with that agent and just seeing, where you fit better. Because like you said, you may think an advantage is better now because of that $0 monthly premium, but down the line, you may have some health issues that arise
Yep.
and the coverage from a supplement would have been much better. But now at this point, because of your health issues, you are now disqualified and no longer can enroll in a supplement. So it's very important to not only talk to an agent, but at the right time as well when you are approaching that age of 65.
Yeah, and not even just not being able to enroll in the supplement plan, but you might still be able to enroll, but the premium that you'll have to pay might be much more expensive
Much
than it
higher.
was when you had that guaranteed issue right.
Hmm.
So let's just say, for example, for a part or Plan G, you would have had to pay, guaranteed issue $150. That could skyrocket. That could go up to 250 even. It could go up to 220. So I mean, it really depends, but if you do want to switch to a supplement plan outside of that guaranteed issue right, you can, as long as you pass the underwriting, but you might be paying a little bit more for the premium. So
And so again, when you are approaching that age of 65, just very important to not only talk to an agent, but also do your own research. Just kind of have an idea where you may be better fit. And with that, regarding effective dates, there was a couple things I wanted to touch on too.
yeah,
With effective dates, we have a lot of people that are mistaken or just make common issues. And so I think the biggest thing with effective dates is knowing that if we talk to you in the middle of the month, let's say now we're talking to you on March 15th, and we are looking at an Advantage plan and everything is lined up. We're going to help you enroll and take advantage of all those benefits. That will only start the first of the next month,
right,
which is a little confusing sometimes. The reason that's important is because if you have procedures or services that you already have appointments for, say this month in March, and now you're switching to an insurance plan that covers those maybe more effectively in April, it's very important because if you go to those services in March, you won't have those new benefits. You would have to wait until April. And so it's
exactly.
it's very important because you may switch from a plan that has no dental coverage to full dental coverage, and yet you have a dentist appointment in March when you're still on your old plan. And so you won't have the benefits of that new
It wouldn't
dental
have gone into
plan,
effect yet.
to take effect. And so that's a common issue we see with that. And I'm sure you see the same thing
Oh yeah.
frequently.
Yeah, all the time. I mean, everybody thinks, not everybody, but a lot of people think that as soon as you get off the call or as soon as you sign up for the plan, it's, hey, I got this all figured out. It's in effect already. With Medicare, that is just not true. It does take a little bit. It's like Sean said, it's going to be typically the first month or first day of the month after the month that you signed up in. So, yeah, just something to be wary of there. Yeah, and another thing I wanted to talk about today was kind of the two main supplement plans and one, slight other one that you don't really have to worry about if you are aging into 65, soon, is there are basically two different types of plans with Medicare supplement that we're going to be looking at here when you call us. So the first one is Plan G, which is, they call it the greatest value plan here. And that's just because it has pretty much no copays. So you're going to pay a little bit more on the premium every month than you would for a Plan N, but you're not going to be facing pretty much any copays for Medicare covered services. So, when you go to the hospital, you're not going to have to pay any copays there. When you go to see your specialist or your primary doctor, you're not going to have any copays there either. So it is really a good value plan, but you are going to pay a little bit more on the monthly premium. Do you want to kind of talk about Plan N a little bit?
Yeah, and just to, briefly touch on Plan G,
Mm.
that is going to have excellent coverage.
Yeah.
Despite maybe a higher monthly premium, it is going to have incredible coverage where, if you're on just Part A and Part B, that's just original Medicare. And basically the structure there is Medicare covers 80%, and then you are responsible for the 20%. And that's kind of why these are called Medigap plans,
Mhm.
because they fill in that gap. They pick up that 20% for you. And so for like TJ said with Plan G, it pretty much picks up everything for you. The only thing with Plan G that you'll have is a Part B deductible, which is $283. So, for example, if you had a Plan G and you went into the hospital and they billed you $50,000 for a hospital bill, you would pay the 283 Part B deductible, and then they would pay the entire rest. So, a very good plan. Despite higher premiums, it does come with a great coverage.
Yeah.
And so, to touch on a Plan N, the main difference there is you have some copays. The first copay you'll have is a $20 copay to see doctors and a $50 copay for emergency care. Then the only other copay you would have there is what's known as an excess charge, and it is up to a 15% excess charge. And TJ, do you kind of want to touch a little more on the excess charge there?
Yeah, so the excess charges, and it's a very rare charge, and there's only so many states that even allow for excess charges. I think most states do allow the excess charges. I think there's 6 states that don't even allow excess charges to be charged. So what they are is basically if you're in a state that allows it, the provider has the option to not accept the Medicare approved rate, and they can charge up to 15% more for the covered services. So that is something that is covered under Plan G if you do get hit with those, and not Plan N. So with Plan N, you would have to, if you did get hit with an excess charge, you would have to pay that out of pocket, up to 15%. Another thing that I want to touch on with Medicare supplement plans is the Part D. So with Medicare Advantage plans, you don't have to worry about getting a separate drug plan. Part D is included with Part C, which is the Advantage plan. With the Medicare supplement plans, you have to have a separate Part D plan that could or could not be an additional charge every month.
Mhm.
So,
And to touch more on that with that Part D coverage, there's also the Medicare Advantage most of the times cover ancillaries such as dental, vision, hearing.
yeah.
With Medigap, the Medicare supplement, again, that is not going to cover those things. And so if, dental or vision is something that's important to you, something that you need to let an agent know, because there are additional coverages that we can help provide you with, but it is very important that you understand that the Medicare supplement does not include those dental, vision, hearing benefits. So
Right.
if you were interested in those, again, like the drug plan, maybe an additional premium, but it is an additional way that you can get some extra coverage there too.
Yeah, exactly. Well, I think we touched on everything we wanted to touch on today. I appreciate you being here, Sean. Thanks for having me here too.
Same to you, yeah.
Again, please guys reach out to us here at the Medicare team. You can reach us at 717-807-7649. We're here, 5 days a week, Monday through Friday, 9 to 5. You can reach out to us here. We have a very friendly staff. We're very, very, passionate about what we do. And we're looking forward to helping you guys out. So yeah, please reach out to us here at the Medicare team.
Yeah. Thank you guys for watching. We'll see you next time.